everybody, to Sit Downs with City Lifestyle Vegas Edition. This is Camilla Soleil Ray, and I have here today a woman that she really works her magic on us, especially women, with her talents and her clinic. Please welcome Shy Smith. She owns Nursie Cosmetics, a med spa here in the heart of Vegas in Summerlin. Shy, please tell us about yourself a little bit.
Absolutely. It's my honor, my pleasure. So that was a lovely introduction, by the way, Camilla. And I do own a medical spa and wellness center right here in Las Vegas. We're pretty much in between North Summerlin and South Summerlin. And I've been in business now 5 years.
5 years, and you are so young. We don't have to tell people how old you are.
21.
Well, you could pass for 21 with your beautiful, radiant skin.
Good. I'm doing a good job.
Yes. And you're originally from Chicago.
Yes.
Right? So tell us a little bit about the letters after your name. Like, who are you? What do you do? And what brought you here?
Yes. Love it. So I am originally from Chicago, born and raised. I moved to Las Vegas 2016, right after college. And I was like new graduate, finished my undergraduate at the time, getting my bachelor's in nursing. And I was like, you know what? I want something new. Like, I want to just get away. And it was like, I wanted this new life for myself. And it was just like, I didn't know where to start, but I knew the new, like, direction was relocating. So came to Vegas 2016, straight fresh out to college. 4 years, did my undergraduate, got my BSc in nursing. Got to Vegas, I was like, wow, a city that really never sleeps, you know? So it was amazing to me to see. And again, I'm from Chicago, a big city, and it was just amazing to see that, wow, like, it's a bigger city, but it's like, you know, so many different areas, and it was still growing at the time. So when I came here, it was still like a lot of desert too in certain areas, like all the new builds we have, it wasn't here, but it was just nice to see like the new environment and new builds. Versus Chicago, it was already pretty much built, but becoming gentrified. So it was just like amazing to be in this area. And then of course the Strip, you know, Las Vegas. But when I got here, I'm like, wow, it's so much other than the Strip.
Yeah.
And I really loved the fact that it was just so many people doing different things. So I got a job right away, critical care nursing. That's my background. And I did critical care, stepped down ICU, did leadership management, all type of things. And these young ladies stumbled upon me in the ER. Was like, look, you look so good. Do you want to inject? I'm like, inject what? And they was like, duh, Botox and fillers. And I was like, wow, because, you know, Vegas, showgirls, just models. Yeah. Everybody wants to come to Vegas, and there's all type of attractions here. I'm like, why not? Got the training from all these medical aesthetic companies that are still known, Allergan, Nurse, and even Galderma. Came in the med spa, knew at the time, had no idea to inject as far as these products, but been a nurse since 2012. So it was like anatomy for me. It was just learning a new anatomy. Always been very artistic or has some type of artistry from fashion, looks, beauty. It's been my thing, right? Like I've been always into that. But when I did my first treatment with an injectable like Botox and like a lip augmentation to be exact, I was like, wow, I like this. And then I realized people were like, oh, you're so pretty. You look natural. I'm like, thank you. And I'm thinking to myself, like, I am natural. But what it wasn't really understood at the time is that people will get work done and some people don't look natural.
A lot of people don't look natural, and that what causes fear
exactly.
to most people not to get any help. Mm-hmm. This person was that person.
Yeah, you're beautiful, by the way. But no, you should. It is scary because when you look at people that look distorted and not normal, that's scary. God. So you think like, if I get that, I'm going to look like that. Yeah. So not only did it attract consumers and people like, not just like millennials, like myself, everyone. So I'm like, wow, this is more than what I thought. And I always thought like, you know, nobody in my family or really around me didn't do those type of things. So it was a lack of education, or I would say, you know, just being ignorant in a nice way. Just we didn't know. And I started doing it. And when my family was like, oh, yeah, I'll be a model. I'm like, you know what, look, I'm going to go to school, get my nurse practitioner, become a family practice provider, do my time, and open up my own medical and wellness center. So it was always a dream for me to do something. I would have even done women's health if I didn't do the route I am in as being an injector now. I always wanted to have more, be more, and be an entrepreneur. Like, that was always in my end goal. Like, when I was younger in high school.
And it's your personality. You are a go-getter. You have grit. You have energy. And you have a vision. You want all the best for your patients.
Yeah, absolutely. And I feel like everybody deserves that. And you got to know you deserve that too. So it doesn't just start with me. I want you to know that you deserve it too, regardless when you leave. So that's why I do my best. And each time I have a patient, when I treat them, whether if it's their face, body, or just holistically, I treat and actually manage disorders, things like that. Now, I let them know, like, you got to be together all around, not just the outside. We got to be together here too.
You got to click the inside with the outside, or the outside with the inside.
It all goes together. I can make you feel good here, but if you're not right here or here, like, I really can't help you, right? And then vice versa. Like, if you feel good here, but you don't feel like you look good here, and there's nothing I can do if you don't believe that you can get more, look better, or get what you deserve, you don't really believe that.
So, and that is a huge part of, trying new things, taking risks, is really believing that you deserve better,
Absolutely.
that you can have and be better.
1,000%.
And then you take the risk, because there are a lot of people walking out there. They can be beautiful on the outside, but they've been so beaten up by life and their circumstances, and they've never gotten help, that they believe that it's not for them.
Yep.
It's not for them.
And then also think about it, the times we're living in, social media, right? So
oh my goodness, yes.
I always tell people, like, not all sources of social media is not credible. Like, I can't give you legal advice. I'm not a lawyer. I didn't study law. But what I can do is give you medical advice or, cosmetic, non-surgical treatment advice, anything that I'm educated, certified, of course, I get my board certification and these things, right? So my thing is social media. Some people believe social media is the truth. And they take experience or advice from people who aren't even credible or have any education on what they're doing. So my thing is, it's just a matter of me with what I'm doing now. The mission is educating. I treat everybody from, of course, look at you, you're beautiful, from every race and variation. It doesn't matter, but also age. Like my youngest client, maybe 21. My oldest or eldest client, I'll just say my most youngest eldest client was 82.
Wow.
That's what I'm saying. So it's just a matter of just being the person to educate the community, the population, and notice that we can get the right change and we all can get the things we deserve, but just take your time, do your research.
And be patient, too, to see the results,
Trust the process. Absolutely. And then these things are an investment, it's not an expense. Me, being 21 now, is, it's the greatest investment. And before these things, I wasn't educated. Even when I first began, like being a novice, doing what I do now. Before I got to this level, I was opposed to a lot of things. But the fact that I began to educate myself more, gain that experience, and, increase my skill, I'm like, wait, this does this. And most people don't even know Botox treats skin disorders, not just for wrinkles.
Really?
Yes.
What kind of skin disorder?
Acne. So
Botox
I used to have
treats acne?
I used to have acne, you guys, hormonal acne. I'm a living witness to it. And I started doing Botox, and I realized that my hormonal acne, because I would microtox my face before I got a laser, and I was like, wow, my pores are closing. And I was just thinking of the fact that I look so smooth, and it even gave my skin more of a radiant glow. So I didn't have to go to Sephora and spend the $600 every month or, every couple of months. I'd rather spend $700 on get Botox and make it last every 120 or 180 days.
Wow, to 6 months?
It's just
6 months. Wow.
Just educating yourself, though. But I would literally go into Sephora Ulta, and nothing's wrong with that, But it's not medical grade treatment. You're not going to get a prescription. You're not going to get.
It's more of a Band-Aid.
It is.
Right.
And it feels good. I'm not going to lie. I'm like a junkie for luxury or anything beauty. And I would spend $200-$300 on a cream. But that cream I'm spending $200-$300 on wasn't really effective for treating the cause or treating my issues that were underlying. So yes, back to what we were saying, Botox treats many things. Acne is one. It's just not for anti-aging. Skin disorders. Women who have melasma and suffer from melasma, most women suffer from that. And as we age, it's hormonal. Botox treats that.
Botox also treats melasma?
That is correct.
Wow, I'm blown away, Shai.
Absolutely.
Wow.
It does. And
Nothing
this is
like
things
education.
I've learned, again, over the last few years, because I didn't have this information. But again, you have to educate yourself. That's why it's always important to choose a provider that's not just credible or certified, right? You want to make sure they're educated.
And they're current, because medicine, right?
That is key.
Medicine is evolving every single day.
I'm literally going to a conference in Dubai next week as we speak, because they have so much innovations in this industry, medicine, wellness, anti-aging, cosmetics, because I'm like, it's so much more I have to learn and I don't know about, but I want to learn. I want to be able to bring that back to my clients so they can have more. Yeah, I feel like everyone who I treat, they deserve the best.
Yeah, they do. We do.
We absolutely do.
We do.
We all deserve the best. I know we do. You look good, by the way.
Thanks.
You're gorgeous.
And I go to Nursie Cosmetics, and the first time I went there was obviously to meet you to see if you wanted to partner up. And as I went and I met you and I learned about you, I'm like, oh, she is good. And then I saw that you offer many, many treatments. And one that caught my attention is the vampire facial.
Ooh,
and I'm like,
fave.
What is that? Tell me, what is it? So share with us, with our followers and listeners, what are the treatments that you offer? What are the procedures? How can women just, because the goal, like I'm 50. I don't want to look 30. I don't want to look 30.
Well, you're starting to look 30, though, so you can't change that.
Well, but that is not my goal. My goal, and I can't speak for every woman out there.
Right, of course.
But
we're all
my goal
individualized.
is to be young, be timeless. I know I'm not going to look 30, but I want to be timeless. I want to age as well as I can. I want to be a kick-ass, gorgeous,
love that
50, 60-year-old looking like I'm 50 or 60, however, timeless.
Yes.
You know? So what are some of the things that you can offer women in our community to have that effect?
Plenty. Well, let's go back and just start with the vampire facial. Clearly, the word vampire, we're reversing your aging. You literally don't age.
Oh, is that what it means?
Yeah, absolutely. Vampire
I thought
facial.
It was because you use the blood.
We do use your blood. So a lot of people don't realize that, yes, that's the vampire part, because we draw your blood and we spin it in a centrifuge to actually use it, because your own blood components, when you're healthy and, of course, doing the pre-treatment as, required like you did, you get the best stem cells, exosomes, and growth factors from your own blood. Stimulate your collagen. So not only am I stimulating your collagen, I'm treating wrinkles, I'm resurfacing your skin with the microneedling portion of it, or I should say the staph is. Also, you are literally giving your skin a fresh restart, that first layer. And we have, multiple layers of skin. We'll have to get into anatomy, but it's the fact that what's the first layer, which is your epidermis. It's the most exposed.
Yeah, it's the one that's seen.
It needs to be most protected. And a lot of us, again, like education, I didn't know to wear sunscreen my whole life until literally maybe like 15, 17, or 18 when I was on spring break in Miami and got sunburned. I'm like, what is this? I never experienced that. But they told me before, and I didn't do my research. They say you don't need it because, the more melanocytes you have, the more protection. It isn't true. You literally are aging and you have all these more free radicals. And you're actually damaging your skin. But that's early damage, and you got to think about it, 20s, 30s, 40s, 50s, 60s, no treatment, no care, no protection. All you have accumulated just damage your whole entire life. So other services that I recommend are very popular, Aerolase. We have a laser treatment, very much safe for every skin tone and type. You can get the laser, I can get the laser, and we don't have to worry about being burned.
Yeah,
because we have
technology,
no downtime. And this is a part of technology, because remember, I'm not going to even hold you and say I wasn't scared to get laser 5, 6, 7, 8, 10 years ago. And I did, because I did get laser before 8 years ago and I got burnt. But my thing is, technology is forever changing. We got to keep up.
And it's not only the technology, it's also the provider knowing how to use the technology.
That one, exactly. That too.
Right.
That's actually more vital than it is actually selecting the technology, because you need to know what technology works for whatever skin type you have, period.
Right.
And that's why we have these things in medical scales like Fitzpatrick scales that literally gives us types 1 to literally 6. And it's just like, you have to know as a provider how to treat your patient, each skin type. And I think, unfortunately, what's happening in the community too, while people are scared, and we get to go back to fear, like education as providers too. Not the client just not knowing, because they don't know. That's why they come to us. Right. But the providers need to be educated too. Other common treatments, again, outside of just laser, we have other lasers that, again, depends on different variants about skin laxity. Are you a candidate for this treatment?
What is that?
So eye laser is another popular procedure. We do literally now non-surgical facelifts.
So let's eye laser. It's the letter I.
Yes, I.
And laser. It's not eye laser.
Yes, it's not an eye laser. I'm not an optometrist or a specialist or eye doctor.
So the name of the treatment is eye laser.
Yeah, literally, eye-laser. So basically, it is a way to get a non-surgical facelift. literally. And
I know. I saw
it's
the before and after pictures.
crazy.
I was blown away. And in Brazil, you can only get that at the plastic surgeon's office.
Plastic surgeons do have it. And
Yeah.
now they have made it where in America, 'cause if you are, long as you are trained and skilled, being only a nurse practitioner or a PA that has been licensed, trained under a doctor, my background is plastic surgery too. It's working in surgical centers too. So again, I've been trained. I have the training, I have the knowledge, but also I have to get additional training too. So it's like, it's forever a training thing.
It never stops.
But once you become independent, of course, like in a state in Nevada, like I have now, I put my time in as a practitioner working with the medical provider or the doctor that was under, you are independent now. So now I'm an independent nurse practitioner in family practice, but I specialize in cosmetics and wellness. Like that is my realm. And I can perform those advanced procedures because I'm trained and skilled now.
Ladies, I tell you, this eye laser is magical.
Crazy.
It really pulls everything up
Everything.
and it tightens.
One
it's
treatment.
It's like you had surgery.
One treatment.
Yeah.
One treatment. And it works for the face and body too, by the way. So it's in like a weak lipo too. We usually administer this procedure. We give you minimum sedation, like laughing gas. So of course you can't drive home or things like that. We usually ask that you get a companion, a discharge. We still treat it like could be a surgery, but it's not a surgery. It's still a procedure though. So I don't want people to be confused. They're like, is that surgery?
No.
I'm not a cosmetic surgeon. I'm not a plastic surgeon. But for the most part, all these procedures and changes, because it comes from technology and innovation.
Yeah.
We have to stay on top of things
For
as
sure.
providers, though, too, to provide the community, our clients, with the best results, right?
Yeah.
Because we want the best. And I think a lot of us don't realize that if you choose wisely your provider, you'll always be fine. And even myself, I can't do everything on myself. I have a provider. I have an injector, too. You know, I have a plastic surgeon. I have a cosmetic nurse practitioner. I even have a nurse to help me and take care of me. So my thing is, it's just choosing the right people. Do your research. And then, of course, our facials, Hydrofacial, our top-selling treatment. I love that thing myself. I recommend getting that once a month. I just got one last month.
That's
I think
why
it's
you look
time.
so, yeah.
I think it's time. And other treatments, like, of course, standard skincare procedures, chemical peels. We have so much. And in IV hydration, that's another component
You have
of
so
taking
much.
care of yourself.
NAD.
NAD, oh my gosh, I love that.
What are the
NAD.
benefits of NAD? Let's talk about NAD for a little bit because there's a hype right now.
Yes,
Yeah.
it is. So it's so hyped up because and NAD, by the way, you guys, is not new. It's been around. It's just more hyped up like social media has made it to be. But it became more popular after the pandemic. The studies and case studies revealed in different practices that people were suffering from chronic COVID complications. And we were like, what can be done? What can we help, right, with you guys that have trouble breathing, still having chronic inflammation, chronic pain, unrelated or just idiopathic skin disorders, people breaking out in rashes and hives every day, don't even know, chronic fatigue, and you have normal blood levels, right? It was from COVID. We don't know. We
Really?
still don't know
Yeah.
why, but we knew that NAD, which is a natural molecule we make in our body. You and I both have this. Everybody has this. But as we age, it depletes.
Oh.
So that's why we don't have as much. So pretty much doing NAD treatments like IV or IM or just injections are the best route to get it, period. You can take it oral. You can do a nasal spray. The best bioavailability, meaning the most effective mechanism of it working and taking action and getting a better result, is going to be IV, IM, or you do an injection sub-Q.
Okay. And
IV.
Sorry, go ahead.
IV is the most potent, by the way, so you will have to get that done in clinic, always. And basically, it is benefiting anti-aging, metabolism, mental clarity, as well as, guess what? It's treating inflammation,
Oh, wow.
chronic pain. I did it. I was in an accident or injury recently, and I was like, I got to get myself back together. So I started doing NAD treatment. Guess what?
You're
I feel
back
good.
together.
I'm back together. So it has so many benefits. I just can't go on about it. But it's a super powerful agent, and now it's popular, which is great. I'm glad people want to invest in themselves, take care of themselves, because it's one of those wellness components I always recommend, a must. Like, yes, helps with healing. So if you go to surgery or if you just have standard medical surgeries, people are coming to get it because they want to recover and heal.
Yeah. And you also have a package for people that want to get NAD. Can you talk to
Absolutely,
us about the
yes.
package?
So we recommend when you first start NAD to do a package. The package typically comes with 2 IVs and 2 IM shots. 2 IVs, meaning you come in the office and you taken care of by the nurse, and they basically monitor your vitals, assess you, because it is side effects that can come with it, but they're very mild, nothing to worry about. But you still need to be monitored because, I mean, IV administration is a medical procedure. People need to do this with medical providers.
Right.
I do not advise doing this at home if it's not administered by a medical provider. Also,
stop getting your advices from TikTok, people. Listen to professionals.
Please do not stop doing stuff and getting black market items, because you can buy all this stuff overseas. We don't know what's in that, by the way.
Right.
Remember, we have an FDA for a reason here in the United States. It is what it is, but you don't know what it is. And it could have been expired from 2 years ago, and they just labeled it and put today's date and next month's expiration.
Right.
You don't know.
Yeah.
So you really got to be careful, and that's why I think a lot of people are having complications. I think the world, we're seeing more so complications of people not doing the right thing or being a little bit more low in quality, like it's cheaper. Like, I'd rather invest. I'd rather go get, like, I'm not going to perform my own plastic surgery, by the way, ever. Like, I'm going to go to a plastic surgeon.
Yeah.
So it's the same thing when you're getting treatments and procedures, whether if it's by a nurse, an NP, myself, a PA, a doctor, advanced esthetician. These are licensed individuals. People, all of us have scopes of practices. We need to stay on our scope of practice. I'm not going to perform surgery. I am not a surgeon.
Right.
Right?
Right.
And I don't expect a advanced esthetician to administer, at least in the state of Nevada, Botox, right? Because they can't inject Botox. It's not legal.
So they have to be an injector.
So you have to be an RN minimum.
So, and at your cosmetic practice, wellness, cosmetic and wellness, you make sure that your the people that work for you have the right license, they have the right training.
Absolutely. You have to come with me with
invest
already.
in your people.
That too. So I do invest in them. They have to get additional training as well, because we have to stay up to date, right? So of course we have to do that. But yeah, you cannot come and work in our organization if you're not licensed in the United States. And that's that. And then you have to be licensed in the state of Nevada. My business is in Nevada. I operate my business in Nevada currently.
So not only are you a very good and talented cosmetic practitioner,
thank you.
You are a very serious and ethical business owner.
Absolutely,
right?
absolutely.
Yeah.
We gotta have ethics. Like, it's not just about work ethic. We gotta have ethics with ourselves and standards, right? Professionals, you wanna be around or get service from people like that. Like, if I didn't have a business, I would go to a business that's credible. I'll do my research, make sure, like, okay, everybody's licensed. Like, before I get anything done, I'm researching.
Yeah.
Before I got anything done outside of, my staff and myself, and if I do anything in the future, I'm researching.
Yeah.
I am, because that's what I want to do. I want to educate myself. The last thing I want to do is not know what I'm getting myself into. But imagine me going into a surgery center or a medical spa, and they are not licensed in the state or licensed out of the country. It's a slippery slope.
It is.
And
I've seen some pretty bad accidents,
Yeah. And then at home treatment, when did you learn anatomy? Like, injecting is just not, because I see an injector doing it.
Oh, it's easy,
I know how to do it. Right. Like, you have to know anatomy.
Yeah.
Muscles, nerves, tissues,
veins,
ligaments, veins. Like, you have to be skilled and trained and licensed for these things. And that's why we have to get these additional, schoolings, or I should say certifications and
experience,
board certifications. Yes, because in school it comes with clinical experience. Before I became a nurse practitioner, I was grandfathered in to become what we say a nurse practitioner or a medical provider to be licensed to prescribe, diagnose, treat, and manage health conditions, because I had enough skill as a nurse, a RN prior. Okay, you can now become a nurse practitioner. You did your time and you graduated up. Okay, now let's go to a little bit of med school. Go work under a doctor to learn how to prescribe, treat, manage. And it's not the same as being a doctor.
Right.
I'm not a doctor. I can let people know I'm a nurse practitioner.
Yeah.
Because I have grown into this role of managing people and diagnosing and treating them. Before, I was just skilled to learn how to do and train how to do. Now I'm trained not how to do things, but how to treat them, come up with the plan, diagnose them. It's so much deeper.
Yes. And speaking of treatment, so you always tell me, it's not like if you come to the office and you get your treatment, it's going to be no use if you don't maintain it at home. Do your part at home. So what tell us about the importance and what a skincare routine should be.
Absolutely. I love that. These are good questions. You're good, girl. Look, you even know your homework. I know you take care of that skin. So that's a great topic to discuss because, yes, we can help you. But honestly, only about, to tell the truth, 30 to 60%, depending on what you're getting, is us. So that means the remainder is up to you. You have to maintain. You literally have to maintain that other 70 and 30%. And people don't realize that other percentage affects your results and your outcomes too. So you don't get to just leave us and be like, oh, I'm good, I look good. No, you have to go home and maintain, right? So basic skincare, medical grade, treatment. Basics is SPF. Please, SPF 30 or greater, okay?
Every day.
And then 30, 50, 75, that's just a time in the sun, you guys, okay? It doesn't mean it's stronger. That's the duration while you're in the sun. So you have to reapply sunscreen. That's what that 30, 50, 45, 75 factor, that's what that means. People think, oh, it's stronger. No, it's not stronger. It's a time.
It's the time that it lasts.
Thank you. It's a time thing. So please reapply your sunscreen, everyone. Then gentle cleansing, having the right products to take care of your skin. We all have different type of skin, right? You may have combination skin. I might have dry skin. She may have oily skin. He may has a little bit of, I don't know, sensitive skin, acne. Everyone is different. So getting treatments customized for your skincare routine at home. So we do that in office. We have so many skincare products, but they're all medical grade, typically meaning that you can only get them in a medical spa or a surgery center or a dermatology office. Typically, medical spas and dermatologists are the top places to go for medical grade skincare. But you have to go home and apply your AM and PM care serums. Every day. It should be a routine. The basic
just
thing
like
you can do,
your teeth,
that part, is part of, your skincare is a part of literally your hygiene. You getting in the shower, you brushing your teeth, like enjoy it. Have fun with it. You don't need 80 steps. You don't even sometimes need 15. And I'm not going to hold you. When you get medical grade treatment, you may just have 6.
Thank you.
Just because it is greater product. You don't need this. You don't need that. So investing in taking my skincare routine, AM and PM, to 6 steps total of the day from 12, you make the investment. And it may be more costly, but this skincare product lasts longer than Sephora. And also, I can tell you that because, again, I'm a product junkie. I just love having stuff, especially if it's good.
But it's not only about the costly in terms of dollars, right? It's like, people, oh my God, organic is so expensive.
It lasts longer, though.
It's not only that. You can pay now.
That part.
Or you can pay later.
Yep, and I'd rather pay the price now. It's the same thing with taking care of yourself, right?
Yes.
Are you going to prevent obesity and lose the weight now, exercise and diet now? Or are you going to wait till you get diagnosed with diabetes type 2 and have to be on insulin the rest of your life? And or still be on insulin, try to maintain the medication costs because that medications is going up. It's not getting cheaper. It's going up in price.
Yeah.
And not have your medication, or you're just going to go to the hospital and get a triple or quadruple hospital bill.
Right.
Like, it's the same concept.
Yeah, it's the same concept.
Individuals who are ready to take care of themselves and invest in themselves, they come to medical spa, wellness centers, or even practitioners of wellness in the realm because, no, I don't want to get sick. I want to take care of myself before it happens. Or I don't want to age, but I'm okay with aging, but I don't want to get to the point where I need a facelift surgically. So it's just so many options and reasons for why you may come and seek things. But like you said, it's that investment. I'd rather pay now because it sure gets expensive later. I can tell you that, just being a medical provider and treating and having people critically ill during a pandemic. I can tell you that it costs us more later.
So to wrap up this exciting and fascinating conversation, because the more I talk to you, the more I get to know you. And I'm like, oh my God, she's so knowledgeable and so talented. I want you to give our listeners, our followers, 3 tips on how to start taking care of their skin.
Absolutely.
And then, let's go from there.
So pretty much the first tip is do your research as far as see if you have skin issues. If you have skin issues, find the right provider. No skin issues, still find the right provider to prevent. So preventative is the first step, prevention. Second, please wear your SPF, you guys. I can't stress it enough. I don't care if you're not getting any work done or you're getting work done. Please wear your SPF 30 or greater always and reapply in the sun. The last thing is once you start doing treatments, whether it's IV hydration, Botox, facials, hydrofacials, vampire facials, microneedling, laser, please choose a provider that is knowledgeable and a provider that you trust. I recommend always doing this because there's nothing like working with somebody you trust.
And feel comfortable with.
And feel comfortable with. The skin is the largest organ of protection that your body is going to have forever. Please take care of it from head to toe.
Very good. And so where can we find you? You already said that it's like South Summerlin, North Summerlin, but give us the exact address.
Yes, absolutely. So I'm located 8360 West Sahara, Suite 220, Las Vegas, Nevada, zip code 89117. Phone number 725-205-1147. And you can find us on social media, all platforms, Nursie Cosmetics Vegas.
You also have a more personal
Instagram,
yes. The injector one,
Yes, I do have my own personal injector. It is the Beauty MP Injector. If you're on Instagram, you can find me under the Beauty MP Injector _shy.
Beautiful. Well, this was Shy Smith, everybody. Thank you so much for coming. What an honor to have you as a marketing partner in the community, and it is my honor to be your client. I am
You
so
look
happy.
good. I just love looking at you. I just admire. I just can't take my eyes off you.
Oh, girl, thank you. Thank you. Keep it coming. All right. Well, thank you so much for watching and listening. And if you want to hear more about Shy, reach out to her directly, or we can have her come back. So,
Absolutely.
see you next time. Thank you.